on, guys? Jay Steve, welcome. Let me get a shirt on for the video so I look half professional. Sorry for the room, not really sorry because I'm cleaning. Got a bed sheet on downstairs, getting those washed, sweep, dusting, all that kind of good stuff. You know, hygiene is the number one thing. All right, I think I'm ready for the video. Let's get to it. What's going on, guys? What's up? Hopefully you can hear me with a fan because it is humid today, very hot. I'm enjoying myself. Today was my day off, so I went ahead and paid some bills. Doing my laundry downstairs right now as we speak, and I am waiting to put the clean bed sheets on real fast. So yeah, how you guys been doing? Welcome. Thanks for the new subscribers. I see that I'm up to 61 subscribers. I see that one of my main videos are up to 1.4K. Thank you, guys. And I'm not thanking just the 6 subscribers who helped me got there, but the non-subscribers who are scared just to hit that thumbs up and scared to hit that subscribe button. Knowledge is power. Knowledge is key. So thank you, guys. About today's video, I got some questions, so I'm going to go ahead and knock them out of the box. I've been trying to get the segment going to where it was on every Tuesday or every, Wednesday the latest. But honestly, it's like they've been getting really slow with everybody asking me. Well, some people ask, some people don't. And how YouTube, like I told you, it breaks it down. It pretty much tells who's asking questions, who are not asking questions. It shows that I'm getting a lot of views. Not much subscribers, and that's fine because not everybody wants to do pharmacy technician. So for the people who view the video who probably are not interested in pharmacy technician, that's great because at least you can see what I do and realize that this is not for you. And for the people who stuck with me and asked brilliant questions, you guys know yourself, thank you. Now also, my channel is not only geared to pharmacy technician or pharmacy in a whole, which I probably have to because that looks like that's the number one topic that sells. I don't want to say unfortunately because, I wanted my channel to be everything. If I got a new if I got new furniture, if I got a new console, if I got new sneakers, and all that's fun and dandy. And I know I can do 2 separate channels or 3 separate channels, but then I have to juggle from one audience to another audience. The only thing I do like about what's going on with the channel right now is that I'm helping people. I mean, I'm actually helping people achieve what I have. The Wilton set, the Vizio set, the Converse, the Jordans, the Nike boots, the North Face, all the apparels, the jewelry, stuff like that. So if I can help someone just make over the minimum, which is $10, $12 an hour, I guess I've accomplished something. And I, as long as this channel keeps growing, let me know. All right. So before jumping into the 10 questions, I want you guys help me pick the next video. So I'm 3 minutes in. I'm probably not going to run through this, make this 10 minutes, but I want you guys to comment in this video, subscribers or non-subscribers, specific topic of what you want me to cover. Please, specific topic of what you want me to cover. It doesn't necessarily have to be pharmacy. It could just be something, a life experience. I've done oil change. I've done anything practical that I've done as a human being that anyone would like. I love glasses. I can show you how the best way to get your glasses on your insurance and not have to worry about it. Or, contacts being $45 a box, I can help guys with that. Or I can just help you with your credit score. So, if you want a career part in pharmacy or pharmacy technician, let me know. I'll do these videos. I know some of the contents won't pertain to everyone, and they probably won't want to watch everything, but, that's fine too. That's what the great thing about YouTube is. It has an audience for everyone. So thank you guys for sticking with me. Thank you guys for just watching the video. Appreciate it. So without further ado, let's jump into the top 10 questions for this week. And if I have any other announcements, I will definitely let you guys, know what's going on. I will definitely let you guys know what's going on. So let me bring up the questions real quick, and then we can jump right into it. I know, right? I'm like using everything just to get everything done. Yep, I gotta find. Well, the questions are not lost, but I do have to find them. All right, so let's jump right into it real quick, and then we'll go ahead and edit it. Hopefully, we can get it done within 10 minutes. And like I said, thanks for watching the video. Even if you watch a minute of it, I appreciate it. So, yeah, thank you guys. Appreciate the love. You know what I mean? Like, hey, you didn't have to subscribe, but you did. Alright, so let's jump right into it. And let's see. Okay, so here's question number 1. Why is the expiration date different when compounding TPN/TNA? And anyone who doesn't know what a TPN or TNA is, it's pretty much a big fluid bag that provide multivitamins and nourishment for patients who are unable to eat or feed themselves, or are on a tube system, a tube feed. So they get this bag sometime for a 24-hour feed, and they run our hospital. They run it from 1800. So that was a good question asked. Now I can only answer in my institution and the product that we use, and we use Baxter for our Clinomix. So in our institution, we give our bag after it's been fused, and additives are added to it 24 hours. Most times, we'll do a little thing different. So when you have the Clinomix bag and it's fused, I know that when it's fused, the bag itself is good for 9 days in the refrigerator without you adding any calcium, any tracer element, any sodium phosphate. So just the Clinomix bag that has the amino acid and the dextrose is good for 9 days in the fridge. Now, sometimes when you add fat emulsion, it will still be 9 days. But once you start adding your additive like calcium gluconate, tracer 1,2, folic acid, thiamine, potassiums, sodium phosphate, sodium chloride, then we actually give it 24 hours. So to answer that question, we normally give 24 hours to our TPN or TNA, and when we make it, if we break the bag and it's not administered, we'll put it in the fridge. If we break the bag to start making it and they call us, hey, the TPN's been canceled, that bag without any additive gets 9 days in the fridge. But once we add something to it, we gives it 24 hours. So good questions on that one. Alright, so number 2 question was, do you have a compounding machine for TPN? 7 years ago, I heard that we were doing more than 4 to 5 TPNs a day in our institution, so we did have a compounding machine. Now we do it by hands. It's not that hard, actually. We have the Clinomix E-Bag that comes with most of the minerals and everything added to it. So once we fuse it, we might have to put like 1 or 2 stuff into it and it's done. So I'm not saying it's not easier. I've been to Omnicare and I saw the machine. It looks pretty awesome. You just put everything into it and it just goes. And you have to reset it because you don't want the wrong doses going. But unfortunately, we didn't do as much TPN as we did 7 years ago. So they got rid of that machine. So everything now is hand done. And sometimes it can be harder. Alright. Question number 3. What's the expiration date when pre-packed medication? Okay, that's a good question. So the hospital try to get a lot of unit dose packs, and unfortunately sometimes we can't get unit dose packs. In my first video you saw where I showed a bulk sell. So what we do is, if we pack something, we normally gives it a year date or the date that comes earlier. So if we're packing a brand new bottle that expires in 6 months, then anything we transfer from that bottle, we'll go ahead and give it 6 months. If that bottle is expired and in 2 years, we still give that product that we pre-pack 1 year. So 1 year is the standard that we do, and if it's under a year, we'll do whatever the earliest date is when it's expired. And that's transferring a meds from the stop bottle and put into a pre-pack. And I did a video showing you the pre-pack on that one. Alright, so that was, 1 was the TPN date difference, 2 was the compounded machine, 3 is the expiration date and pre-pack. So let's do number 4. So number 4 is there a difference between formulary and non-formulary medication? Alright, so there's 2 parts to that question. So in retail, you might have brand and generic, which would be non-formulary, formulary, where insurance is considered. They have a formula list of what meds they'll cover, and anything outside that they're not covered. So not that brand or generic is considered non-formulary formula, because if there's no generic for a drug, then it will be on your formulary. Now, to answer that question in terms of the field that I'm in the hospital now, we have a formula list of what we have, which I guess is certain brands, certain generic. So we cover for all the patients. And if something is compatible when they come in and get admitted, we'll switch to what we have. If the doctor wants them to have what they have or be taken at home, the patient has the option of bringing in the meds and we'll label it and send it back up to the floor. But it all comes down to pretty much price. That's really what it is. Is the hospital will do a formula list to cut costs as well. But we try to make sure we have anything that any patient need, so that we're not getting anything different. All right, good question. All right, number 5. Do you get a different pay doing different tasks in the pharmacy? Good question. Actually, we don't. In the hospital I work at, all our techs are cross-trained. So no, but I've heard of other hospitals paying a different rate if you're IV, a different rate if you're chemo, a different rate if you're Pyxis, a different rate if you're pediatric. Apparently, ours is such a small hospital. I mean, it's a big hospital, it's such a small hospital. All our techs get the same wager to learn all the tasks. Now, mind you, you have some techs who are not as capable, and they don't do the same thing as others, which I know is not fair, but it's up to the director or the management to say, hey, this guy can do all, he should be compensated different than the ones who can't. But pretty much everyone's supposed to be cross-trained in the hospital at work. So good question. Alright, so now we at number 6. Do you administer vaccines? So no, I don't. I know in retail the pharmacists are licensed to do it. In a hospital, the pharmacists are licensed to do it as well, but we have a Sure Health or like you call it, a health department within inside our hospital, that there's trained nurses who will give vaccination to the employees on higher dates, on yearly dates, or even if you go into school, they actually covers the vaccination. So the pharmacy itself or the techs does not administer vaccination, and nurses on the floor does it as well. Good question. Are tattoos forbidden in the pharmacy? Great question. That was number 7. So I would say yes and no. When we were hired, for people who worked on the floor, they say if you have offensive tattoo, to go ahead and cover it up because it might offend the patients or the patient's family who comes in. Pharmacy, we do see patients, and we do see patient family because we have to go on the floor. But to be honest with you, they give that speech in orientation, but if you look around your ER and you look around every floor you go, it's almost like it's coming in norm for people to have tattoo. I think if you have an offensive tattoo, your management might ask you to cover it up. So I don't want to say yes, I don't want to say no. It all depends on your institution. I know when I was hired, they told us, it needs to be covered, but 7 years in, I'm seeing a lot of tattoos out. Both nurses, pharmacy, maybe even some docs. Alright, good question though. Alright, so number 8 says, do you like helping others? Do you like to help others? Sure. I mean, I make these videos for you guys, the fans, the audience, for everyone. So yeah, I do like helping others. Alright, number 9. What was your experience in retail? So I had a good experience in retail. I was hired by some awesome person. My experience with retail, Walmart that I started with, didn't go sour until I got another job. And then they kind of started treating me a little bit bad if I showed up late and stuff like that. But I had a good experience. Number 10. What's easier to fill? what's easier, filling prescription or inputting prescription? So that's a toss up. For retail, filling was always easier. Um, Filling was always easier than input because it came out in print, so you saw what you were looking for. Although some people's shelf were generic to brand or brand to generic, and you got to figure out where it is. But if you learn where the stuffs are in alphabetical order, obviously filling is the easiest task. But for anyone who has any weakness inputting prescription, I recommend that on slower nights of the pharmacy, probably like 7 to 9 if you're a 9 to 9 pharmacy, jump in input. Believe it or not, it's strengthening yourself and you will get better at it. I know it's hard when the pharmacist throw you in there, when you're busy, but yeah, do it when when it's a slower time. And I want to go back to question number 9 because there was a debate in my a debate about experience in pharmacy. So let me give you a little back history about the debate about the pharmacy. So when I started Walmart, I started at, I think, 18 years old. I was a cashier. I did maintenance. I cleaned a bathroom. I cleaned a gutter. And it was good pay for me at the time. I wasn't paying any rent. Wasn't anything. It was like, I started at $5.75 an hour. And I got hired by an amazing pharmacist by the name of Kevin. I think at the time Allison was there too, and she was amazing. Richard was there too as well. And my overall experience was that they saw something in me that others didn't see. And that was at Walmart, and they actually they took the chance with me and they hired me, and they trained me and they helped me grow. And even when my mom got sick with her eyes, they make sure to give me a day on Wednesdays. It used to be Wednesdays that I used to take my mom to the doctors. And so everyone have a good story and a bad story at retail, and they want me to recommend a company. I don't want to recommend a company because the same company that I just said, I've heard people say bad experience with. I would say if you started with a company and you haven't transferred in pharmacy yet, go start a rapport. Feel that pharmacy out. See how they work along together. Ask a lot of questions before you transfer in the department. If you apply directly inside the pharmacy, you pretty much can tell someone's character right away. If they're a certain way and they're not genuine, then I would say just get out. But I didn't have bad experience. I was even always running late to work, and they catered to that. Now, when I said the bad experience started, I would say we did knock heads, even before Kevin leave, and I had an amazing pharmacist by the name of Heather. She was awesome. Girl made less error. She was her people skills maybe, but she was awesome. If you ask her, she might say nah, or her head button started way before then. He was always late, and there's some truth to the story. But I feel like once I got another job, and I was working in the hospital full time, and I was trying to do Walmart full time. I was running late, and I'm not gonna say I didn't run later than what I did run. But me and her started knocking a lot more head, so I had to transfer. I just transferred out to another store, and I transferred to another store another pharmacist that was at the store that I was there, and I ended up working for her before she got her own store. So but you're talking about working in a pharmacy for at least what, 7 years before, 10 years before actually transferring to another pharmacy before the problem. So my experience at my first job wasn't bad. So I'm sorry that other people have experience where you didn't have a fingerprint to ring customers up, or they put you in a field that didn't. And to answer your question, yes, they're supposed to train you. We got CBL time. We got all this other stuff that we could have done. To send you back for an hour. I know right now a lot of jobs are probably short-staffed, so they're trying to just throwing you in there. But yeah, we got a chance to really learn. We had one-on-one experience. So, read your handbook for the store that you work with, the policy. Talk to HR. Make sure that they're doing what they're supposed to do, which is getting you on the CBL training, giving you train time, and not just throwing a new tech with no experience. Guys, I'm here for you guys. Thanks for this segment. I'm going to go back through, make sure I got all 10 questions. Hopefully I did, and a little bit of explanation. So I know, hopefully you guys have a good weekend, and see you next week when I upload a video. Wow. I think it's like 20 minutes in. Who knows? I didn't want to do this long, but I had to get it off my chest, and YouTube also gave me the platform to upload over 15 minutes. Alright guys, thanks for watching. Peace!